Welcome back to Parasitology. Hi, I'm Christopher. In this video, we are entering the blood and tick-associated apicomplexan world. The name apicomplexa refers to the apical complex, special machinery used to invade host cells. Our job is to keep four clues connected: host, route, infected cell or tissue, and syndrome. Is the organism in red cells, leukocytes, phagocytes, or tissue? Did the tick feed on the patient, or did the patient eat the tick? Same arthropod group, different plot. This is our map. Babesia gives us the red cell pyroplasm and hemolysis. Pathogenic bovine Theileria adds an important leukocyte Cytauxzoon phase before the red cell pyroplasm phase. Cytauxzoon in felids moves through mononuclear phagocytes, then red cells. Hepatozoon is the route outlier. Dogs become infected by ingesting an infected tick, and the major clues are leukocyte gametes or tissue phases, not a classic red cell pyroplasm disease. Sort them by host, route, cellular address, and syndrome. On a blood smear, paired piriforms support Babesia. Piriform simply means pear-shaped, which is exactly what these paired organisms may resemble. Small single or signet ring-like pyroplasms may support Theileria species in an appropriate ruminant context. A small marginal inclusion without a pyroplasm pattern should make you consider Anaplasma marginale, which is a bacterium, not an apicomplexan pyroplasm. Morphology helps, but it is not definitive. The smear is a clue, not a confession, so PCR and speciation may still be needed. In dogs, large canine Babesia, represented here by Babesia canis, often produces larger paired piriforms. Babesia gibsoni typically produces smaller single or pleomorphic forms. Clinically, think hemolytic anemia, fever, lethargy, pale or icteric mucous membranes, thrombocytopenia, splenomegaly, and sometimes hemoglobinuria. Tick transmission matters, but direct blood exposure matters too. Dog bites and transfusion are important clues, especially with B. gibsoni, and vertical transmission has also been reported. A smear may reveal organisms, but PCR is usually the stronger confirmation at the species level. Babesia is named for Victor Babish. Dog plus intraerythrocytic pyroplasms plus hemolytic anemia should make you consider Babesia species. In cattle, the major threats are Babesia bovis and B. bigemina. B. bigemina commonly forms larger paired piriforms, although single forms occur. B. bovis is smaller, often paired, at an obtuse angle, and may also appear singly. The clinical pattern is fever, hemolytic anemia, pallor or icterus, hemoglobinuria, reduced production, and sometimes abortion. Severe disease and cerebral babesiosis are particularly associated with B. bovis. Red urine is not a subtle clue. The epidemiologic context matters as much as the smear. Cattle plus rhipicephalus tick exposure, red cell pyroplasms, and hemolysis or hemoglobinuria should make you consider B. bovis or B. bigemina. PCR, herd history, geography, and blood work complete the picture. Theileria changes the cellular story. Pathogenic bovine species have an important Cytauxzoon phase in leukocytes, followed by erythrocytic pyroplasms. The two stages do not need to be equally conspicuous at the same time. Think leukocytes first, then red cells. In cattle, fever, lymphadenopathy, anemia, weakness, weight loss, and potentially high morbidity or mortality fit the pattern. Theileria parva causes East Coast fever, while Theileria annulata causes tropical theileriosis. The genus honors Arnold Tyler. Cattle plus fever or lymphadenopathy plus leukocyte Cytauxzoons with or without red cell pyroplasms should make you consider Theileria. Cytauxzoon felis is easiest to understand as a triangle. The tick is the definitive host, and the felid is the intermediate host. Bobcats are the major natural reservoir, while surviving domestic cats may remain carriers. During feeding, the tick transmits sporozoites. These infect mononuclear phagocytes, where schizogony can produce large schizont-laden cells. These can obstruct small vessels, and this schizont phase drives severe systemic disease. Merozoites invade red blood cells and become small pyroplasms. They may support diagnosis, but they can be absent early and may persist in clinically healthy survivors. The tick ingests infected erythrocytes during feeding, completing the cycle. The practical distinction is simple. The schizont is the major villain. The red cell pyroplasm is an important witness. Hepatozoon is the route exception. The dog is infected by eating the infected tick, not by being bitten. While H. canis and H. americanum share this unusual method of infection, their diagnostic detection and clinical presentation differ. H. canis can often be identified on a blood smear. Its large oval to rectangular gametes may distort infected neutrophils or monocytes. An infection may be mild or subclinical. H. americanum is more commonly found in the muscle and bone, with tissue merons, severe myositis, fever, neutrophilia, weight loss, and periosteal proliferation. The vector also differs. The Gulf Coast tick, Amblyomma maculatum, is the classic vector for H. americanum, while the brown dog tick, Rhipicephalus sanguineus, is associated with H. canis. Diagnosis may involve blood smear, PCR, and for H. americanum, muscle biopsy or tissue evaluation. This is a leukocyte or tissue parasite, not a erythrocyte parasite. The name Hepatozoon combines the roots for liver and animal, but do not let the name trap you into thinking this is simply a liver disease. ALP may increase with either species, and with H. americanum, that elevation may reflect its extensive bone reaction rather than hepatic injury. Here are the routes on one slide. Babesia, Theileria, and Cytauxzoon are typically inoculated during tick feeding. Hepatozoon is different. Dogs acquire infection by ingesting an infected tick. And H. americanum may also be acquired through infected prey. This distinction helps organize the life cycles, but it does not diagnose the patient. Host, geography, exposure history, affected cell or tissue stage, clinical syndrome, and confirmatory testing must all be considered together. One important exception to the tick feeding pattern is canine babesiosis. Babesia gibsoni may spread directly when infected blood contaminates bite wounds, particularly during dog fighting. Blood transfusion and contaminated instruments are additional transmission risks. Same tick world, different route, different biology. Let's close with 5 patterns. Dog plus intraerythrocytic pyroplasms and hemolytic anemia, consider Babesia species. Cattle plus tick exposure, red cell pyroplasms, and hemolysis or hemoglobinuria, consider B. bovis or B. bigemina. Cattle plus fever or lymphadenopathy and leukocyte schizonts with or without red cell pyroplasms, consider T. parva or T. annulata. A cat with acute febrile or ichoric disease and mononuclear phagocyte schizonts with or without red cell pyroplasms, consider Cytauxzoon felis. A dog that ingests an infected tick and develops leukocyte gametes or tissue merons, consider Hepatozoon. H. canis is the blood smear clue, H. americanum is the muscle and bone clue. That is the practical rule. Host, route, cellar stage, and syndrome narrow the differential. PCR and speciation confirm. Thanks for watching. I'm Christopher Lee, and what you know today protects everyone tomorrow.